Hi, my name is Shrithika Neupane, an environmental science student at UNH. I'm doing internship at Upptik in the position of career and media explorations that might help for the high schooler, and I'm getting the interview. Hi, Betsy. Can you intro yourself to my high schooler?
Hi, my name is Betsy. I am from Connecticut, born and raised in Stamford. I went to high school at Trinity Catholic, a private high school. Um, I am currently working at St. Vincent's Hospital as a respiratory therapist. After high school, I went to University of Hartford, also in Connecticut, and yeah,
Oh, that sounds good. I have you said you are the therapist, right?
yes.
And it's your first priority to being a therapist, or it's
Well, when I got to college, I actually didn't really know what I wanted to do. I know I wanted to be in the medical field, but and by the time I figured that out, they didn't have nursing at my school, and that's how I learned about respiratory therapy, and I just went for it. And I actually like it. I like it better than nursing. We deal with the airway, life support, things like that, breathing issues, asthma, COPD. Whereas nursing is more of a broad spectrum, whereas with my brain, it's better for me to focus on kind of, I mean, it's broad, but it's not as broad as nursing.
yeah,
There's
and
a
that
focus.
and you got the you got the inspirations from some way to get that therapist in respirations, or you just do by yourself, like someone inspire you, or you just get.
No, no one really, because I didn't really know anything about it. I didn't know anybody that was a respiratory therapist.
Oh,
Um, it was only really the only option as far as what is in the medical field that was at my school because my school didn't have nursing.
oh.
So, right, and I was already there and I wasn't going to transfer and do all of that. So I learned about it through there. And the dean of the college, kind of guided me through and what it would look like.
Oh, and how's your high school goes back days? Like it's fun, and you like how does you prepare for the nursing? You said you are first choose the nursing path because you don't have the nursing course in your college. That's why you go into the respiratory therapist. So you did the preparation for the nursing. How you did the preparation for those things?
Well, it wasn't really preparation. With the private high school, it was just, your basic high school and then um you kind of choose a school and what you want to focus in. But it wasn't, I don't think my high school really prepared me for more. I did better in college than I did in high school for sure.
Okay.
Yeah.
Any advice for the high schooler, for their career choose? Like so nowadays, people got so confused. There are a lot of opportunities, and
Right.
in the,
Honestly, the best advice that I would give is I wouldn't chase after the money. Yes, it's important, but if you don't love what you do and you're just doing it for your money, for the money, it's not going to work out the way you think it's going to work out. You're going to hate waking up, hate going to your job, and mentally that's not the way to live. So I would recommend choosing something that you're passionate about, something that you love, and seeing how you can turn it into a profit or seeing how, your life would look like with it, because peace is more important than the money at this point. And mentally being, stable, I think, is one of the biggest things for me. I wake up, I mean, I'm not the richest person, but taking care of people is what is important to me and is what I enjoy. I love my coworkers. We work together, and our common goal is to take care of the patients and make sure the patients are well. So, and that's really important to me. So I would say to choose something that you're passionate about, something that you're good at, something that you can see yourself doing for, a long time.
yeah, and is your career going smooth, like as you imagined before? It
Well,
goes
it
better?
wasn't. To be honest with you, it wasn't. I started at a doctor's office. That was fine because our exam, the state boards is two parts. So when I passed the first part, I started working at a doctor's office for a lung doctor, a pulmonologist. And then I passed the second part and I started working in a hospital. And that wasn't a good experience because of, my, the just it just wasn't a good experience. So I ended up doing long-term care, which is like nursing homes and things like that in New York for about 3, 4 years. I was there, ahead of COVID. That was really a scary experience dealing with that. And then at a certain point, and I was driving from Connecticut into New York. So that was a lot of my car, a lot of my body. So I made the choice to come back into Connecticut I was still living in Connecticut, but to come back and work in Connecticut. And there's no traffic when I go to work in the morning. It's great. I enjoy waking up and going to work. Um, so yeah.
Hope it goes smooth for you now.
Yeah, it is. It really is. I'm, looking for other opportunities as far as something to add on to it, like per diem as needed, or even doing something totally different because, as everyone knows, life is getting a little bit harder financially for everybody. So just trying to find something on the side or anything like that. But my main focus and my main job that I do full time is at the hospital.
Oh, that sounds good. Now the last things, for if you had a chance to go back in the back days, then what you will do the like for the preparations for your better career options, like anything you want to do that?
If I were to go back, I think the only thing that I would have done is chosen probably another college that wasn't as expensive.
Okay.
Because it wasn't a state school, it was a private school, so those student loans and things like that. So I probably would have been smarter with the route that I went for college, whether I did a 2-year community and then transferred, or just did community. I think that would have been a better option in hindsight looking back because now the student loans and things like that and the career, depending on the type of career that you're doing, it really doesn't help in the sense of making enough to pay those off in a timely manner.
Yeah,
Yeah.
it's a hope, but we can't go back there.
No,
Maybe.
I know, but if I had the opportunity, that's the only thing that I would change. But as far as my career and things like that, I don't think I would change anything. Now that I work alongside nurses, I work with them every day. I don't think I would want to do that. They deal with certain things that I don't think I could stomach. Um, so yeah, I don't think I would change too much, just how I did it, only for the finance for the, finance purposes of it. Like be smart, like don't go to the most expensive college unless you think you can pay it off, in 4 or 5 years and things like that. But it's really hard. So I would always tell people like if you can, find a cheaper route to do and achieve the career that you want to do correctly, that's the only advice I would give because signing up for the loans and things like that, it's quick. They'll give you the money quick, but then when it comes time to pay it off, the second you graduate, the bills are knocking.
Yeah.
Yeah.
Okay. Any advice for the nowadays high schooler to choose their career path or like make a decisions to selecting the course?
I mean, if they're undecided, I would, have a list of, 3 or 4 different career paths that you would want to take and or yeah, that you can see yourself doing and just take those classes. Or if you know somebody in those positions, maybe shadow them for a day or, just take some classes and a little bit of everything. Because I think you have like 1 or 2 years before you can actually declare a major and things like that. So kind of just test the waters and take a few classes or talk to people, the upperclassmen of those schools that are in those careers and talk to them and see how their journey is. I think that would be the best option to do is actually talk to the people who are in those career paths or on the path to those careers that they're looking to take an interest in.
Thank you so much. Hope your experience will help to the high schooler to
I
choose
hope
their
so
career path.
too.
Thank
Thank
you
you. And
so much.
Of course. Thank you.
Have a good one and enjoy. Thank you for
Thank
your
you.
time.
Of course. Of course. You're welcome.